Let's go back to training, the profession. I mean, UCSF is the place of everything new. So tell us, what is coming from your
So many
department?
things. So we have, well, first thing is that everyone knows that the number of physicians that we need in the future are not what we have right now. So one of the things that happened because of actually one of the graduates of UCSF who's now, he's chancellor at UC, down UC Irvine. His name is Michael Drake. So Dr. Michael Drake, when he was, before he left, and he was vice president for University of California, he actually set up the first initiative in 30 years to expand the medical school class at UC. So for example, UCSF, they started a program called the PRIME program, which is a program which is focused on community-based interest among the students. So we actually now have at least 4 classes of students. So it was actually the first time in 40 years that UCSF has expanded. It's because of Michael Drake's work that something like that has happened. Now we're trying to expand things, but of course we're doing things slowly, because if you expand things at the medical school level, for example, there are 3 new medical schools in Florida that they're opening up. Now one thing I found out, I was just in Florida at a meeting, I found out of the first year classes in those 4 medical schools, only four of the students are African American. Right, so we have major challenges in terms of ensuring that diversity, whether or not it's African American, Latino, Asian American. We have tremendous struggle. We're really going to have to begin to really put pressure on organized medicine to make sure that there is diversity. I mean, they understand that people who are diverse and who go through medical school have a greater chance of working in a community of diverse patients, but expanding the numbers really takes a long time, because the pipeline is so long. If you're looking at 4 years of college, 4 years of medical school, 3 years of training at least, it's a very long pipeline. I mean, I look at young high school students, and I said, well, I did 4 years of college, 4 years of medical school, 3 years of training afterwards at the very minimum. I actually did 8, so I did a lot more because I'm a surgeon. Right? They look at me like I'm crazy. They're like, well, I'm going to spend, they want to make money now, right? And I'm telling them that, okay, this is a very noble thing you could do, because it really is a wonderful profession. You get to do great things. Now, obviously, this movie focuses on the challenges in the inner city, but just when we go home at the end of the day after a very busy day, you do get a chance to impact people's lives in a very positive way, and each of us who are healthcare providers really get a chance to do that. And I think what I try to do is, because I spend a lot of time with medical students, I'm in charge of undergraduate education for the surgical department of surgery where I'm at. What I try to do is inspire the students to see that there are many ways that you can do things. And if you want to be a surgeon, that's great, but you have to do what you love. So if it's primary care, that's fine. If you want to be an OBGYN, or a pediatrician, you want to be a family practitioner, there's so many pediatricians, there's so many wonderful areas to do. So what we have to try to do is really reach out and inspire people to understand that they can do it, that it's something they possibly could do. Because when I was growing up, I really didn't have role models. Nobody in my family went to college. Nobody was a doctor, right? So it really takes you kind of getting out of your comfort zone when you're coming up and say, well, listen, I could do that. I mean, one of the great things about the president being elected is like, wow, there's an African-American president. We were joking, was joking a little bit early on that many of you in here probably went to the inauguration. I went with my wife and family to the inauguration because I had to go there because I had to see whether that really happened or not. Right? I didn't even believe that, and I'm like, so you're like, wow, he's up there. He's really the president, right? And then he gets reelected, so I had to go again just to make sure again, right? We're doing it, but so to seeing somebody in positions that you have with folks up here, with folks in the community, because there's many leaders in the community who are out there watching the movie also, doing things, but we really have to make sure we inspire the next generation to pursue what we do, because somebody's going to have to take care of us. I mean, because somebody will have to take care of us, and they can't be somebody who is not the best. Because one of the things I talk about with my students is like, you want to be the best. You don't want to be this. You want to be the best at what you do. Not just I'm going to be just an average. You're going to be you're going to be the best. So no matter who you are, you're going to be the best at what you do. And doing the inspiring is something that's very important.
Okay, and I guess outside of inspiration and passion, money falls in line, and it was amazing to me. I heard a little story about the commercials that were aired, I guess last year, or last, whatever the season was, about Affordable Health Care Act. And I think they were like 480,000, and 400,000 of them were negative. So the uphill battle to convince people that this is a good thing is going to be a tough, tough battle. So let's turn down to where the policy is being made and where the person who's read all the words of the act. Tell us, what do you see in it at this point that hasn't already been sort of raked over the coal to set the stage for failure? Both of you. Sorry. Yeah, both.
I don't have a lot of good news. I wish I did. You know, we're in the implementation phase, right? We passed the law, rah, rah, everyone's gonna get health care. It was fantastic. A lot of us are out talking about how this is gonna be a great opportunity for folks to get health insurance, and then when you have health insurance, you go to the doctor, you get healthier, all of those things. But now we're in like the rubber meets the road and we have to get things done, and it's not going very well. We have an administration right now who is a Democratic administration. That's who's there. But who they are acting like is not a Democratic administration. We're being met with a lot of challenges in implementing health reform, especially for low-income populations. I would say that we are making strides in private insurance. You know, part of the Affordable Care Act was making sure that everyone has access to care. If you have pre-existing conditions, you can still get in. It's going to be affordable. They're going to give money to make sure it's affordable. And that's all happening on the private insurance side. We've set up an exchange, covered California. They're doing it. They're doing good work, absolutely. On the public insurance, Medi-Cal, the health insurance program that right now covers pregnant mothers, low-income seniors, individual disabilities, that's being expanded so that pretty much everyone that's low income can have health insurance. If you're unfortunately an undocumented immigrant, you won't have access, but you need to rely on the safety net, so we need to make sure that we have a safety net. But that work, that expansion of the healthcare system, our administration doesn't really want to do it. I mean, if I can be candid, they don't really want to do it. And it's really becoming a justice issue for those of us that are out there fighting without money, right? I'm not pharmacy. I don't have a lot of money. I'm not insurance. I don't have a lot of money. I just have the, we need to do this because it's the right thing to do, is really falling on deaf ears. I mean, it's just, it's honest. We should have been ready to implement this program so that we can, you know, pass the laws we need to pass, and we can get our county eligibility workers ready to go and enroll people so that we can streamline our application. Our Medi-Cal application right now is 20 pages. You have to go to the county office. You have to present your PG&E bill, like the gentleman that needed to prove his income to get reduced prescriptions. You have to prove all that. Well, Obamacare, which I don't like that name, but whatever, the Affordable Care Act, they said you can actually use the internet. Oh my God, we actually have things like the IRS, like Homeland Security, like, you know, everything is online that you can say, are you a California resident? Awesome. Are you making X amount of dollars or not? Awesome. We can check that. 10 minutes, you're done. Our administration doesn't want to use that. They want to stay in the paper-based world. They want to make it difficult to get insurance so that they don't have to be responsible for providing you care. And again, like I said, the majority of folks that would get that care is us. It's communities of color, and it just continues to, the disparities that we already experience in our communities, it just keeps them going. And it's just, it's really sad, and I wish I had a rosier picture. But you know, the budget came out in January. It looked really bad. He really didn't even want to do it. He set up all of these kind of, I'll do it if. And the all do it if is if the county gives them money. And I don't want to get too long-winded, but right now the thought is, well, the county provides indigent care, right? The county medical insurance program that they were offering to these individuals that they can have it. County pays for that. They get some funding from the state and they get some funding from the federal government, but the county pays for that. And they think, well, okay, so when folks get insured in January, that's going to free up some of those dollars, right? They're not going to have to pay for those. So the state wants those dollars back. Well, wait a minute. Counties aren't flush with any money. I don't know if you guys are aware, but Our counties are broke. We're struggling to provide the care that we're trying to do now. So where is that savings? It's not there. And if you give back all the money, that doesn't allow for providing care for the folks that will remain uninsured. It doesn't allow
I'm going to
for-
ask you to pass the mic along because I want to talk to the commissioner who is
She
going
just
to
gave you the hook. Did you notice that?
I'm sorry. It's hard. It's hard in Sacramento.
I appreciate what you're saying, but I'd like to sort of shift the mood or the, connect the dots for a second. And to one of the things that you said, Dr. Campbell, one of the things that you're saying, you wanted to make sure that Obama actually that he'd actually been elected. So you had to see it for yourself. Well, if you think about it, it's people who look like us who got him there, right? So it's going to take the same kind of, I think, determination from people in the audience and every community, and particularly communities of color, to really fight for what you're talking about. And we have to really push that. But I'd just like to ask, how many people in this room have actually sat in an emergency room and had some of the experiences that we saw in the film?
Oh, my God. Yeah.
That's it. We can all relate to that. And as I was thinking, it's by the grace of God go I, something my mother taught me, right? And so it can happen to anyone. I've been in San Francisco General Hospital in the same situation. I think we can all relate to that. But if we really want to see change, then we have got to take the same kind of energy, the same kind of determination that we had when we elected Obama to the White House. We have got to make sure that there is a change and that people like us have an opportunity to get health care. That's the only way it's going to happen. It's got to be from the bottom up.
Okay, we're going to move to Tony. You haven't had much to say, but I know the work that you're doing is all important, and it fits right in with the comment from the commissioner there.
Absolutely. And one of the things that is very clear to me in the work that I do is that I have to work with the community to make it happen. And having you and your willingness to invest what? Time, to invest the energy, to set aside a Saturday afternoon like you did today. We have to continue to do that because it's only from the bottom up that we'll be able to have these changes implemented that are so needed. And we're very fortunate in the health department that we have some really awesome leadership in terms of our health commissioners, but in terms of our director of health and our director of public health. We have the vision. We have people of color in leadership who are willing to make the effort. And what we need, though, is the ground force. All of you, and you all are probably touching the health department or one of our hospitals in regular ways. You are at our clinics, you are at our primary care clinics, our behavioral health clinics, you're at our prevention opportunities, all the things that are happening, but we're going to have to go beyond that. When you think about our community and what has actually galvanized us into actual change, go back initially to the civil rights movement, but you can go back when you think about where we came from. It's that kind of grassroots, continual investment of time, your voices, writing the letters, the phone calls, attending the meetings. That is what's needed, and I need you to do that with me at the health department, but my colleagues need you to do that at the state level. At every level of government, whether it's at the national or the state or the local, we need more of us. And I think when I look at my work and the relationships, the greatest actual products is when you've had the community there. When I think about one of our current projects with cultural competency at the organizational level, this has happened because of the stakeholder task force, which is the community. You've been working with me to make that happen. And so when you think about all the things that we have before us with ACA implementation, in order to make it real, we're going to have to get in the governor's ear. I was talking to my colleague earlier, and we're going to have to sit with her and figure out what we need to do to have our voice at the table, whether it's Commissioner Cohen and everybody here, we've all got to be at the table. And I go to these health commission meetings and all the meetings that we have with the Board of Supervisors. We need to be there with a strategic plan, not just there yelling and screaming, but with a real coordinated plan. And that's what we do on these afternoons and after hours. We sit together and strategize, just like our forefathers and foremothers did. How do we come up with a viable plan and a timeline and a real project goal that can be evaluated? activated. And that is what we can do if we invest the time. So when you think about all these opportunities we have before us, we're going to have to go back to what brought us here, which is every one of us investing our time and our resources and having really strategic planning. When you think about Dr. King and the work that they did, it was so strategic. It was planned, it was well thought out, and that's why we were able to have the outcomes that we have. And we want to be able to continue to work with you in that very meaningful way for all of the ACA implementation. If it's really going to improve our health, if we're going to actually reduce those disparities that seem endemic to our community, we're going to have the continual partnership with you to make that happen.
All right, I'm going to give the supervisor, because time is running short, just an opportunity to say, do you think that the board has any idea yet, ideas that they have been able to, I guess, to work through their own particular systems to find out what San Franciscans think about this bill? Have you all had any opportunity, any hearings, nothing so far? Okay.
No.
That was very brief.
I think that what happens is that we lean on the healthcare professionals, so that's where the director of public health and the commissioners become very influential, because what happens is they come in and they brief us on how this will have an impact. For example, I'm meeting with Barbara Garcia next week, and part of that conversation is about the impacts on general, when we start to enroll, I think, was it 1.9 million people into the expansion of care and coverage. The other thing that is always striking is the amount of resources that we do have available that go unused. We think we've got Healthy SF. We've got a lot of people that fought for Healthy SF, and I was in the Bayview, and there was an African-American woman, breast cancer survivor. I was talking to her. She was lamenting over she didn't have resources to do something. I said, well, are you in Healthy SF? And she said, no. So I mean, there is obviously a disconnect, and I was just thinking about going back to that to the scene in the documentary where that man who was on dialysis, he was really angry and he was cussing out the doctor. See, if CJ was in there, that wouldn't have happened, right? If CJ was there, she would have made sure that didn't happen, but she also would have made sure that he was connected to the different service points, but also as the other thing I've noticed is that, well, sometimes when we talk about the African American community, you've got middle class African Americans that are college educated, and then you have those that are on their way to being college educated, and then you have those that are not college educated. And oftentimes there's a misconception that because we have health care, we are not affected. These are indigent populations that do not affect us. But I think if we took a moment and really assessed ourselves, even within our own family, we still have members that are not quite there, that are struggling and that are working hard. And we talked a little bit about the safety net. Oh, now she's rushing me. She got me started, and now she wants me to stop.
I'm rushing you.
Okay, well, there's more, but I'll save it for later.
Okay.
I can take a hint.
There are a couple of important questions. We're out of time. Actually, I'm running over about 2 or 3 minutes here. But this question was interesting. Does the Affordable Care Act provide for tax credit for documented healthy living? Is anybody down at that end of the table who are on the...
Documented healthy living?
That's what the question says, documented. I imagine if you're in a program, Perry, that you're running that says that you're living healthier and doing what Kaiser's always told us to do, you know, about taking care of ourselves. Has anybody looked? Is there anything in the bill that would award? Anybody know? We don't? Is something
I don't think we have. I don't have the answer, but I'm of the opinion of our. I forgot your name, Aunt.
TAHIRA.
Tia. That's the piece that we've got to watch, because that's the piece that keeps moving. It's about prevention and wellness, and all those dollars really going to stay there. Because if we can show that the wellness programs work, I think it's great. At the same time, I want to give props to Kaiser, because Kaiser has a wonderful and an interesting model of all the prevention programs that go hand in hand with their hospital. I think it's something that we all can learn from.
Yeah, no, I wasn't sure if I understood the question completely, but one thing that we're working on at Kaiser is certainly addressing health disparities, and now that we can actually look even internally at our own populations and see where the health disparities are, we've had a great movement to focus on best practices and funding different pilot projects that now we're replicating. So for instance, we have a colorectal cancer screening program that we've shown really does make a difference, and that we're actually making available to the community as well. A video that we can show to educate people to understand the importance of colorectal cancer screening, and that's something that we can advocate and we can share. And as well with Kaiser, in terms of the community benefit, they certainly had several different programs, particularly chronic conditions programs around diabetes, around asthma care, et cetera, that we use internally that we've shared with the safety net as well. And I think, again, the more that we work together to focus on those prevention and wellness programs and managing chronic conditions, the better.